This project has been an exciting project. It came as the result of an innovation grant that we applied for and was awarded through Northern Counties Healthcare and Northeastern Vermont Regional Hospital. So it's been a collaborative project. The design of the project was to work with Vermonters who receive Medicare and Medicaid. Some of these are the most challenging, most vulnerable cases. It's been a pleasure to be able to focus on these folks and to hire a health coach to work with them and to find things that they may need that aren't covered by Medicare, Medicaid, or a gap in service. For instance, eyeglasses are never covered, but if someone can't read their insulin bottle and they end up in the hospital, wouldn't it have been wiser to be able to get them their glasses? And this grant has allowed us to do that. The idea of it is to keep people healthier and to keep them, frankly, from needing to come into the hospital so that they're happier and healthier.
In 2011, dove headfirst into a shallow river, fracturing my C5 and C6 vertebrae in my neck, leaving me wheelchair bound for permanently, and left me quadriplegic. And before my accident, I was picked to go in the second round of the 2011 draft. I had the Blue Jays to the Marlins, Astros, Red Sox, Yankees. So I just had a fastball, curveball, and a slider, and I threw a changeup. I was a closer. Yeah, I threw 95 to 98. Whoa. Working with Community Connections has enabled me to get out and get connections with other people, other businesses like vocational rehab that have helped me get back into the workforce and help mobilize my vehicle so I can get out and about.
So as a community health worker, one of the most rewarding parts of the job is helping people learn to self-manage, to overcome their own barriers to what they have. And we do that by education and by helping people to identify and problem solve themselves. So it's great when you see someone that goes from, in a crisis to someone that can redirect and solve their own problems. Self-management is a tool that's great to see happen in a client.
Working with Lou as a health coach on this project has really helped, and he was able to acquire some flexible funding, especially to help repair my vehicle. Last winter I was out with a vehicle for over 2 months, leaving me non-independent, always having to rely on my father, my sister, or family. A lot of people in my situation say that it's not quite getting your legs back, but it is in a sense, because you get your independence back, having a vehicle, able to get out and go to the doctors or go to the store, go to the movies with your friends by yourself. So those few months that my truck was out of commission, it was pretty tough. So it helped a lot. Lou helped me get a primary doctor, set everything up, make sure I had everything I needed, with shower equipment to accommodating me with anything I needed at the house, making sure everything was wheelchair accessible, the bathrooms are handicap accessible. So once we made sure that was all set, me and Lou kind of moved on to, I had spoke with him about a new wheelchair, letting him know that me coaching baseball and being in the variety of different conditions, weather conditions up here in Vermont, I would need a more stable, sturdy wheelchair with better traction so I can actually maneuver in the weather. So we're actually still working on that. Also with the truck, that was the key thing, because that's going to help further my goals into helping at youth services, helping youths that are troubled or who have gone without families or are looking to transition into their own housing and learning to be independent on their own. and I really enjoy working with the youth like that. My biggest goal is to keep coaching baseball, because that means a lot to me, and it's been my passion all my life. I played it since I was 5 years old, and now that I can't play it anymore, I still want to be in it, and I want to teach younger kids that, you know, if you want something, you got to work hard for it.
You know, having that ability to really go into the home, see what people are living with, and listen to the person, identify what their need is, and then access those flexible funds has kept people out of nursing homes, has given them mobility that they haven't had in years, has given them a chance to go to the adult daycare service because they couldn't move to get out of there. So we've got lots of things that are going on that have been very successful.